Dr. Fauci testified in the Senate yesterday. He said the U.S. will face needless suffering and death if the U.S. reopens our economy too soon. Take a listen.
Because I feel if that occurs, there is a real risk that you will trigger an outbreak that you may not be able to control, which in fact, paradoxically, will set you back, not only leading to some suffering and death that could be avoided, but could even set you back on the road to trying to get economic recovery, because it would almost turn the clock back rather than going forward. That is my major concern, Senator.
And listen, I get it. COVID-19 is a tragedy. We already know that. It's awful how many Americans have died from the virus. And I think we're all willing to do everything within reason to protect vulnerable people from COVID-19. But do lockdowns actually work? What science is Fauci's pro-lockdown fear-mongering based on? Because here are the scientific facts. Young, healthy people and children are at very low risk of dying from COVID-19. In New York, the fatality rate for people between the ages of 18 and 45 is 0.01%. For kids, the fatality rate is statistically 0%. Multiple studies have shown kids are not significant vectors of the virus either, meaning they rarely transmit it even if they contract it. The people at the highest risk from COVID-19 are the elderly infirm, in nursing homes especially, and even during the lockdowns. Many state governors, like New York's Andrew Cuomo, were forcing nursing homes to accept COVID-positive residents into their facilities, which of course caused the virus to spread like wildfire. Meanwhile, young, healthy people were locked down in their homes. And 66% of new COVID hospitalizations in New York were people who stayed at their homes, which means the lockdowns didn't help. In fact, scientific studies show transmission of the virus happens indoors among family members 18 times more often than outdoors via casual contact. Studies from Hong Kong, Taiwan, Germany, and Japan all confirm that. Furthermore, when people take individual measures to prevent transmission, like they did at the Wisconsin elections, when 300,000 people voted in person, that is effective. Scientists found there was no detectable surge in COVID cases after the Wisconsin election. Remember why we originally locked down 15 days to save hospitals from being overwhelmed. But the facts show hospitals aren't overwhelmed. And that has nothing to do with the lockdowns. Hospitals haven't been overwhelmed because the modelers and their projections were wrong from the beginning. The prevalence of COVID-19 is much higher than we were told originally. In New York City, for example, up to 25% of residents have COVID-19 antibodies already. The hospitalization rate and fatality rate is much, much lower than originally projected. By the way, new studies from this week show the herd immunity for COVID-19 might be much lower than we thought too. Not 60%, but anywhere between 10% and 43%. So what science is Dr. Fauci using to push for more lockdowns? Scientific studies from Germany and Switzerland found the curve of the COVID epidemic peaked before the lockdowns took effect, meaning individual social distancing was all that was needed. The lockdowns had negligible impact on the outbreak in those countries. Here in the United States, according to data analysis by Stanford's Dr. T.J. Rogers, there is no statistical correlation between lockdowns and COVID deaths in U.S. states that locked down early versus states that locked down late. Places that didn't lock down harshly at all, like Florida, Sweden, and Liberty University, haven't seen the outbreak we were told would happen. Georgia, in fact, lifted their lockdowns weeks ago and hasn't seen the giant outbreak that pro-lockdown people predicted. Meanwhile, 30 million Americans and counting are unemployed. Dr. Fauci predicts more people will die if we lift the lockdowns, but what about the people who die from the lockdowns? From economic devastation, starvation, delayed medical care and canceled surgeries, domestic abuse, violent crime, suicide, drug overdose, alcohol abuse, despair, and fear of going to the ER for heart attacks, strokes, and other fatal medical emergencies. Yes, people will die if we lift the lockdowns, just like people will die if we keep the lockdowns in place. Dr. Fauci should know better than to fearmonger.